What if the magnesium you've been taking every night is quietly failing before it ever has a chance to work? I'm Dr. Emily Carter. I've worked with older adults for over 20 years, and I keep seeing the same pattern. People faithfully take a supplement, yet they still wake at 2 or 3 a.m., still get muscle cramps, or still feel restless. Today I want to reveal the hidden reasons why magnesium may not be helping, and give you safe, practical next steps you can take with your healthcare team. You'll learn why the number on the bottle isn't the whole story. 5 quick questions to help diagnose the problem. 4 common mistakes that undermine magnesium's benefit, and food-first options that often work more gently and safely for older adults. If you know someone over 60 who takes magnesium, share this with them. It could prevent a needless problem. Let's begin with a simple idea that changes everything. The milligrams printed on a label are not the same as what your body actually uses. Think of the tablet number as the volume of water you pour into a filter. Pour a gallon into a filter that's clogged or poorly fitted, and only a trickle comes through. That trickle is what we call bioavailability, how much magnesium your system actually absorbs and puts to work. Aging changes digestion, gut bacteria, and even the way other medications affect the gut. So before adjusting doses or buying more, ask 5 diagnostic questions. What form of magnesium is it? How well could it be absorbed by your body? Is your lifestyle helping or hurting that absorption? Could your medications or kidney function be changing how magnesium behaves? And finally, what is your goal? Sleep, muscle relaxation, or general health? Answering those will guide safe next steps. Hidden reason 1. Trusting the label number. The most common mistake I see is assuming that the milligrams listed equal benefit. A bottle might say 400 mg, and that feels reassuring. But older digestion, low stomach acid, changes in gut flora, or even certain foods and drinks you take with the pill can reduce how much actually gets absorbed. Using our filter analogy, imagine swallowing a full cup of water, but having it pass through a very fine, clogged filter. The number on the cup didn't change. What reached the other side did. That's bioavailability. It isn't a judgment on you. It's a biological reality that becomes more important with age. So what can you do? First, check how you take the supplement. Some forms absorb better with food, others on an empty stomach. If you have chronic digestive symptoms, persistent constipation, long-standing reflux with acid-suppressing medications, or recent antibiotic use, mention that to your clinician because those things can affect absorption. If you've been taking the same product for months with no benefit, don't automatically double the dose. Instead, bring the bottle to your next appointment and ask whether the form and timing make sense for your goals. A pharmacist can be very helpful here in assessing the product's likely bioavailability and how it might interact with what you already take. Hidden reason 2. The wrong form for the goal. Not all magnesium is the same. There are several common forms you'll see on shelves, and each behaves differently. Magnesium glycinate tends to be gentler on the stomach and is often preferred when people are taking it to support sleep or to ease muscle tension, because it's well tolerated and less likely to cause loose stools. Magnesium citrate absorbs reasonably well, but commonly produces a bowel-stimulating effect, which some people use intentionally for constipation and others find disruptive. Magnesium malate is sometimes chosen by people looking for energy support or to reduce muscle discomfort during the day. Magnesium oxide is inexpensive and widely available, but it's among the least absorbable forms and is more likely to sit in the gut and produce bowel symptoms without offering much of the mineral systemically. Choosing a form should start with your goal and your tolerance. If sleep and calm are the main issues, a form that's usually well tolerated for evenings, like glycinate, is often suggested by clinicians, but that doesn't mean it's right for everyone. If your concern is constipation, citrate may help, but could be too activating at night. If you have long-standing gastrointestinal conditions or take medications that change gut motility, speak with your physician or pharmacist before switching. Always view what's often preferred as a starting point for conversation, not a prescription you follow without clinical review. Hidden reason 3. Lifestyle factors quietly cancelling out supplementation. Imagine you're trying to slow a car by pressing the brake, but you keep hitting the gas at the same time. Magnesium can act like a calming brake for nerves and muscles, but caffeine, high evening sugar, inconsistent sleep patterns, chronic stress, and physical inactivity can be the gas pedal that negates its effect. Late afternoon coffee, nightly sugary desserts, or a habit of sleeping at wildly different times can interfere with sleep quality and muscle relaxation, even if magnesium levels are adequate. Small, realistic changes go a long way. Avoiding caffeine after mid-afternoon, replacing an evening sugary snack with a lower sugar option, or a small serving of a magnesium-rich food paired with protein, and committing to a gentle daily walk can all enhance how a supplement performs. Consistent bedtime routines help your nervous system switch into rest mode so the potential calming benefits of magnesium aren't drowned out. I encourage gradual shifts. Pick one habit you can change today and build from there. These are low-risk, practical habits that support magnesium's work without adding medications. Hidden reason 4. Medication, kidneys, and the heart. This is the one I take most seriously. The body's handling of minerals changes when kidney function is reduced, and several commonly prescribed medications alter magnesium levels. Diuretics, certain blood pressure medicines, and some long-term antibiotics can increase magnesium loss or change how it's distributed. Conversely, in people with impaired kidney function, magnesium can accumulate, and that can be harmful. For older adults who take multiple prescriptions, the balance that keeps minerals within a safe range can be more fragile. Before you start, stop, or change any supplement routine, check with your physician or pharmacist. Pharmacists are particularly skilled at identifying interactions between supplements and medications. If you've had any history of kidney disease, reduced kidney function, or a heart rhythm disorder, ask your doctor whether magnesium is safe and which form or timing is most appropriate. Don't stop prescribed medications without a clinician's guidance. If a healthcare professional suggests monitoring, follow their recommendation. Safety comes first. Let's step back and tie these ideas together. When magnesium seems not to work, it's often not because the supplement is bad, but because one or more of these factors, poor absorption, the wrong form, lifestyle habits, or interactions with health conditions or drugs, are in play. The same supplement can help greatly for one person and do very little for another because our bodies and daily lives differ. Now I want to talk practical choices that lean towards safety and everyday success. If you're considering supplements, think food first. Whole foods not only provide magnesium, but also other nutrients that help the body use it, and they come with fewer interaction surprises. I want to highlight 3 foods that are particularly friendly for older adults: prickly pear, bananas, and dates. Each has a role, benefits, and cautions. Prickly pear may not be in every grocery store, but where it's available, it's a wonderful choice. It's rich in fiber, contains magnesium and potassium, and brings antioxidants that support overall health. For older adults, the fiber helps with digestion and slower absorption of sugars, which is helpful for steady energy and gentle effects on blood sugar. That said, because prickly pear also has potassium, if you have kidney disease or take medications that affect potassium levels, check with your provider. A practical way to use it is to add a small portion to a salad or blend it into a smoothie with a protein source. The fiber and protein together make the magnesium more useful and prevent spikes in blood sugar. Bananas are familiar and convenient. They provide magnesium along with vitamin B6 and potassium, making them easy to add as a quick snack. For many older adults, A banana mid-morning or as an afternoon snack paired with a handful of nuts or some Greek yogurt offers magnesium and sustains energy. But there are cautions. If you have advanced kidney disease or are on potassium-sparing medications, the potassium content can be an issue and should be discussed with your clinician. For most people without those concerns, a banana a day is a low-cost, low-risk way to add magnesium into the diet. Dates are nature's sweetener and are higher in natural sugars, fiber, and some minerals including magnesium. They can be useful in small amounts when you want a healthier sweet option compared with refined sugar. A couple of pitted dates stuffed with a small piece of nut or a smear of nut butter make a portion-controlled treat that provides magnesium and fiber. The caution here is for people with diabetes or those watching carbohydrate intake. Portion control is essential. If blood sugar management is a concern, work with a dietitian to find the right serving size and pairing to minimize glucose spikes. If you choose to add these foods, pair them with protein or healthy fats when possible to slow absorption, avoid blood sugar spikes, and improve the overall nutrient payoff. Food first doesn't mean supplements are never useful. Sometimes they are helpful, but it does mean building a foundation that supports magnesium's effect and lowers the chance of side effects or interactions. When to involve professionals. If you take more than 2 or 3 regular medications, if you have known kidney disease or borderline kidney function, if you have a heart rhythm disorder, or if you experience unusual symptoms like prolonged weakness, numbness, or severe gastrointestinal upset after taking supplements, reach out to your healthcare team. Ask for a medication review with your pharmacist to look at interactions. Ask your physician about whether magnesium is appropriate for your kidneys and heart. And if you want individualized dietary guidance, consult a registered dietitian. These specialists can help you weigh the risks and benefits based on your full medical picture. A common question I get: how should I time magnesium if I want it for sleep? There's no universal answer, but a reasonable approach is to take a form that's usually gentle for evenings, like glycinate, about 30 to 60 minutes before your intended bedtime, if tolerable. If a form tends to loosen the bowels, avoid taking it right before you sleep. Remember, timing matters alongside lifestyle. A consistent bedtime, reduced evening light exposure, and avoiding late stimulants will make any supplement more likely to help. Another frequent question: can I take magnesium with other supplements? It depends. Magnesium can interact with certain minerals and medications, and the absorption of some minerals can be affected when taken together. If you take multiple supplements, calcium, iron, zinc, consider staggering them and ask your clinician or pharmacist for a personalized plan. Again, the safest route is to bring your supplement list and medication list to a professional review. Let's pull everything together into a compact, practical checklist you can use at home before changing or adding a magnesium routine. First, identify the form and the exact milligrams on the bottle and bring that information to your clinician or pharmacist. Second, consider whether your goal is sleep, muscle relaxation, bowel regularity, or general wellness. Pick the form that's most often chosen for that goal, but only after a professional green light. Third, look at your lifestyle and make one small supportive change. No caffeine after mid-afternoon, reduce late-night sugary snacks, or add a short daily walk. Fourth, prioritize food first. Try prickly pear where available, add a banana as a snack, or use a couple of dates in controlled portions and pair those with protein or healthy fat. Fifth, check safety. If you take multiple prescriptions, have kidney issues or a heart rhythm condition, schedule a medication and kidney function review with your pharmacist and doctor before adjusting supplements. Don't stop or change prescribed medications without guidance. Before I close, I want to repeat a key point with calm urgency. These are preventable mistakes, not reasons for panic. The fixes are usually simple conversations and small lifestyle adjustments. If you suspect you might have kidney issues, or if you're on medications that could affect minerals, start there. The safest path is a short conversation with a pharmacist or your doctor, showing them the bottle and describing your goals. They can advise whether the form is appropriate, whether the timing is right, and whether any monitoring is needed. If this resonated, type magnesium in the comments below, so I know you're here and we can build more content like this for people over 60. If you found this useful, subscribe for practical, evidence-aware health guidance for older adults and their caregivers. And please share this video with someone you know who is over 60 and takes magnesium. It may save them from a preventable problem. Thank you for spending this time with me. I'm Dr. Emily Carter. Stay curious, be safe, and take small steps that protect your health.